And so if we look at enterprise, we have Dr. McCoy, which had a lot of nice diagnostic tools like the medical tricorder, a scanning device, which could assess patients' condition, detect diseases and so on. Biobeds in a sick bay, like diagnostic beds with built-in sensors, and also a very nice medical computer system who could diagnose but also synthesize treatments, medications. And nowadays we have all these things. We have diagnostic wearables with our watches, with rings. We can monitor heart rate, blood pressure, glucose, the saturation. We have POCD kits which analyze blood, urine, saliva instantly. We also have contactless biometric sensors in beds, something like a biobed on the Starship Enterprise. And we have very powerful computer systems, AI-powered, which can analyze complex data, such as treatments. Also, we have robotics compounding chemotherapies, or 3D printers for pills. There is an enterprise who sells or makes marketing with the slogan "Nespresso machine for pills." So, from the creative part of literature, which could be the vision which we have for the future, we have to concretize. We have just imagination alone does not transform or bring transformation. So, when we have a clear vision where we want to go, we have enter it and combine it with our mission and our values. If we have a strategy or corporate values, we can put them together. And then we have to define strategic goals. Which are the goals which we want to reach? And then we can concrete targets that also make the progress measurable. And then we have to see how we get there to this goals. That's our strategy. And the strategy should end in an execution plan. So we came from vision to values, mission, strategic goals, the concrete strategy, and a very concrete execution plan. For digital transformation or digitization, we have two approaches. The first one, where you have as told, a corporate strategy or medical strategy in a hospital, you think how to optimize your processes, and then you go in digitization. You have optimized design processes, and this is the basis for your digitization. The opposite is that you have digitization strategy, you implement software, and the organization follows this digitization. And as we see in both ways, we see that information technology plays a key role in organizational development in hospital. And if we look at the patient journey in a hospital, we see that it starts before admission. We have tools now for communication, for interaction with patients, for scheduling, planning. Then we have the admission, we have diagnostics, therapy, and then after dismission, we have the discharge or dismission management. And this whole process is very complex because, like this example for therapy, if we look only on medication, we see there are concepts like medical security programs, closed loop, antibiotic stewardship, and so on, which define a little bit how medication management is in a hospital. And then the different steps in the workflow, like prescribing, dispensing, in the pharmacy, like with the Unit systems and others, administering on the patient, documenting, and also the monitoring, like if we have we look at the consumption of antibiotics in hospital. From my point of view, it's very important to take a process analyze. because often you have digital and analog workflows which coexist, but there are no synergies. If you don't analyze the processes, you don't know where you can optimize, where you can optimize with automation or digitalization. It's also important to see what works in your in the processes in your workflows, and where the pain points are for the people working. Very important is to structure the way you do analysis. I think one of the most important things is to visualize processes. There's written there, if you can draw it, you don't understand it. You can use diagrams, flowcharts, and so on. And it's very important also, you have different stakeholders. You have the technicians, you have the physicians, you have the nurses. And if you can visualize things, it's more easy to understand each other. Then another important point is the second one, assign responsibilities. It's very important to define the process owners, like the department heads, and they have to understand that the processes are there, and they should be very interested to optimize them. And then you have the normal steps, analyze the current processes, set clear goals, optimize step by step, then implement it, evaluate and iterate, like the PDCA cycle. In process analysis, there are two major challenges, I think. On the one side, you could, if you analyze in a very detailed manner, the processes, you have an overly granular model, and you can get lost in the details and don't have the big picture, and also don't really understand where you can optimize your processes. On the other side, the opposite, overly abstract models on the right side, which also are not optimal, because you don't reach reality. You undermine also the credibility by the stakeholders. They don't understand how you can make the process too abstract. And so I think there's important to see what's the purpose of the different analyzed models, like operational, strategical, or technical, and so you can do a better analysis, and then use combine or layered modeling and combine high-level flows, and then dive in more granular analysis if it is important. Different changes are for digital transformations, or different inputs came from different stakeholders, from different fields in hospital. We have strategic or regulatory requirements. We have process-related changes, like if we implement a new technology. We have user requirements. That's very important in hospital. Technological changes, because we have new version of our software, so something like this, and also project-related impulses inside the hospital. To try to filter all these inputs, and also to prioritize and make a portfolio strategy, we implemented in Augsburg and now in Nürnberg a digital board. Who's involved? Medical staff, for sure, with the clinical expertise, the nursing team, the IT department for the technical implementation, and also the administration, because there are economic aspects or resource coordination which we have to see globally. What are the core responsibilities of this team? To optimize our hospital information system. That's the first core task. Then digitize clinical and administrative workflows and try to automate where it goes to put automation in, and also to ensure transparent change management communication. So in Nürnberg, we had a very fragmented IT infrastructure and architecture. The legacy systems were need for modernization, very heterogeneous process landscapes in the different worlds, in the different departments, and increasing demands in terms of quality, efficiency, and workforce relief, and also a final point of cost effectiveness. And that's not a standalone project, or digital transformation is always a deep transformation for an enterprise. We had nice funding of about 30 millions from the Hospital Future Act here in Germany. This doesn't seem like a smart hospital, but this was the starting point in Nürnberg. We had a lot of paper with all the problems which we know. Our goals were to improve quality of care with safer, more personalized and more efficient healthcare delivery. We want participatory care for our patients. We want staff relief. With model tools, automation, we can reduce the documentation workload, and so we have more time for our patients. Financial sustainability and also innovation and the external perception. We wanted positioning the Klinikum Nürnberg also as an attractive partner for research, education, and also industry. We developed a very detailed digital strategy, and we had 4 strategic action areas: patient-centered technologies, process digitization with very big projects like a new hospital information system, a new patient data management system is the information system for intensive care, for ICU, and data value creation. We had to implement a new data warehouse. We try to do AI analytics, and we try to reach new research initiatives. On the other hand, with the progress of digitization, the risks are greater, so we had to improve IT security and data protection for our patients. We had 2 big key projects. One was the implementation of a new hospital information system. We changed everything at our hospital, and we see a modern information system as the core infrastructure for the hospital, for digitized or a digital hospital, and we wanted to optimize the workforce all across all departments for critical care, nursing, administration, and also for management. With a lot of paper before, we couldn't improve or implement AI innovations. Now we have automated wound analysis, predictive analytics for sepsis, delirium, or kidney failure, and we use NLPs to support coding and discharge letters. Yes. For the second part, the second field, very important for the patients is how they can contact us, how we can communicate, and we implemented a very big and nice patient portal. And from the hospital point of view, if you have a digital communication, you have also a staff relief, because through automation you have lesser workload. So the next year we will finally have a final implementation of our information systems. We are going to expand our Wi-Fi network, which also is a very big project of about 20 millions in Nuremberg. We have 2 campuses, and a very important thing that we are doing now is the change management in the IT department himself. The next years we will, on this base, go further with our digitization and our process automation. We will implement more telemedicine, that's the plan, and establish a resilient and nice IT research infrastructure. If we speak about digital transformation, we often think about technology, about software, but at the end, it's just about people. that are colleagues from Nürnberg, from the nursing staff, and to bring forward these big projects like the change of the entire information system. Was very difficult. Changes are are difficult for humans on the one side. On the other side, you have a lot of different stakeholders in the hospital. You have the users, nurses, therapists, physicians. You have administration. You have construction infrastructure for the Wi-Fi, for example. You have the product management, the project management. You have finance. And you have to put together a lot of different interests in hospital. So if you want to bring technology on the ward, you need the technicians on one hand, because you need Wi-Fi for this kind of devices, which is very difficult to bring in old architectures like in Nürnberg, and also for fire protection for the batteries, and the hygienic department for the keyboard and so on. From I would say 60% of paper. Now we are 90% digital in Nürnberg. We have very nice user interfaces, and at the moment the users are very happy with this. And that's other kind of example I wanted to bring. The speech recognition is very useful for our physicians. On the other hand, patients or outpatients or patients in our emergency departments go home with a discharge letter now. Before, the secretaries were writing them, and then they sent it at the general practitioner or at home of the patient. Now the patient goes home with his own discharge letter. That's another example. It's a so-called spot check monitor, where you can very easily document the vital parameters like saturation, blood pressure, and so on, and automatically it writes the values in the patient chart. And so it's a nice relief for our nursing staff. To bring these big projects and transformations, I think it's very crucial to have clear structures, defined roles in the enterprise, and also to use the adequate methods like project management and change management. We have at Nürnberg, we have a very very transparent and very good structured project portfolio. We monitor the performance, and we monitor very strict our digital projects, and we always try to make these projects interprofessional or interdisciplinary. And like it's a principle of lean management, we try to optimize continuously our clinical relevant applications and our systems. As it is, this software is just the instrument, and it's all about people. It's very important to become familiar with the instruments which you implement, and so I think it's crucial to have a good training, good instruction of the new things you implement. We had 7,000 employees to train, and we had for 4 months for the information system, for the new information system, for 4 months we had 10 classes parallel in the morning and 10 classes in the afternoon. A very big also logistic thing. As mentioned, change management is very, very important because the changes are very close to the people, and project success, they say, depends 2/3 on the people who are affected by the change, not by project managers or something else, but the people affected by the change. I'm a friend of quick wins, and also to make party if you achieve a milestone. In my experience, that's very important. And the other thing is the communication in change management. In Nürnberg we have a WhatsApp channel, we have podcasts, internet for sure, and we have town hall meetings for the whole staff to try to make a good communication in terms of change management. The most difficult change I had is the change of the mindset of the IT department in Nürnberg. The IT department was in a comfort zone, very slow moving, very retrospective, and I had the department of clinical application management who resisted to the introduction of a new information system. And so I say it was from the bunker to the bridge, and we tried to realign this department to a proactive partner in digital transformation, a cultural shift from why change to how can we lead change. We should, as the professional staff, lead the change. As mentioned, the project and change management as methods, as basic methods, and then we hired 5 or 6 new elements that brought fresh perspectives in the old stuff. So, I said, I think that people are the heart of any transformation, and for this kind, also for digital transformation. And digital transformation is not just technology alone. Common pitfalls regard not the technical part or the project part, but often we have a lack of vision, unclear goals, and the missing human focus. For that, cultural skills are critical, and transformation need a very strict change management. And on the other hand, I think it's very important to have clear structures in the enterprise and to use methods like project, process, and change management. Thank you very much.